afternoon, ma'am. Good afternoon, friends. A warm welcome to all. Now we are here to discuss about the autism and the ADD. And she is Suganit. She is a specialist of psychology doctor. And I am the Srikanth. Now we will explain about what is the autism. What is the prevalence of autism and what is symptoms of autism?
I think I'm Suganit teacher.
Yeah, what are the symptoms of autism and what are the causes of autism? And next one is what are the treatments for the autism. Now we'll explain about what is the autism. Here, autism means, I will say about the autism means ASD. Autism is the autism spectrum disorder. We'll call about it, and it is a very complex, and it is a problem in developing of the brain of the disorder, and it will be mainly occur in the children who are the 0 to 3 years. Mostly will occur, and mostly it will occur in the female. Female is less than the male. And coming to the here, autism in auto is children are locked within themselves, because here the children are locked within themselves means they will lock their brains and they will not think about what they are doing. They do not think about what the work they are doing. Next, there are 3 categories of the autism. The first category is the less communication, either non-verbal or the verbal. There is less communication, and the interaction is less, and social interaction, and they will injure by own self. They will injure. They associate with intellectual disability. Intellectual means the mental and the physical, psychological disability and attentionless, and they will not listen towards the others what they are saying. And there is a physical issues like the sleep. The physical issue which are saying about the autism, I am saying is a physical issue like the sleep means they will sleep more than the time and the less than the time they will not sleep. So in both cases I am saying that the physical issue is sleep. Typically the age is 3 years. And next, here the prevalences. Here the prevalences means, meaning of prevalences is commonness, and commonly occur in the children. I already told about children and 0 to 3 years old. And prevalence is 2 to 6 of the thousands, and 2 to 6% of 2 to 6 members of children will occur out of 1,000, and 4 times prevalent in the boys, and it will be most occur in the boys, not in female. This effect is not related to the family income and family influence. There is no influence of the family. By the birth, they will have this problem, autism. Next one, I will explain about the symptoms. Symptoms means what are the symptoms when they are facing the autism. The first symptom is social interaction and communication skills. They have less interaction with the others. They will not interact with the others. They will feel like one, and they will feel like the individual. And the communication skills means they did not talk to everyone, anyone, the verbal or non-verbal communication, and they will difficult to communicate with others outside of the world, and they will injure by their own self. Like that, they will take these things like and they will beat itself. These are things like they will injure. And next one, their self-injurious behavior may be present, and they will repeated body movements. They will hands at the legs, and they will be always repeated to move repeatedly. And next one is unusual response to people, and next one attachments to objects and resistance to change the routine life. The routine life will be changed. They will be changed from daily to daily. They will not just stay in one place in every time like that. And senseless interviews. these are the about the autism. Now I will explain about that. What is the autism? What is the prevalences? What are the symptoms? Now our doctor will be explain about that. What are the causes? Why it will be happening? Why it is causing? And next, what are the treatments for the autism? Can you explain, Suganti?
Thank you. I'm going to explain the causes of the autism. In autism, it's not like a disease or something. It just comes by the birth. If someone has in the family in the olden days, then it goes from one place to another place. Usually it is seen in the children. At the early age, if the child is doing something like that, beating himself or throwing things on others, it doesn't mean that the guy has or the girl has the disease. It is they're used to it. Only few people have this disease, and mainly in girls it shows. And for boys, after a few ages, after he was grown to some age or she was grown to some age, then these symptoms may be shown. So before these symptoms, you decide whether it is a disease or not. You have to go and show to a doctor or tell to one. So now the treatments. We have 3 types of treatments. One is sunrise, flow time, ABA, which is applied behavior analysis. In sunrise treatment, we have we like to spend children with their family members, so that they know how to talk with. They know how to how to do what the things should be done, so that they can be left alone. In flow time, we just have the diagnosis, we don't treat them with the medicine. We'll treat them by talking to them how to do it. It's not good, bad. In behavior analysis, we just use the techniques for teens and adults. These are the other treatments by using music, auditory, talking therapies. These therapies can be used for the children. And
thank you for saying about the treatments and the causes. Now we will move to about the next topic about the ADD. This is the attention deficient disorder, and what is the prevalences and the symptoms and the causes and the effective approach for the treating the ADD. Next, she will explain about what is the ADD. Can you explain to them?
Yeah, ADD is nothing but it is also exactly like autism. It is also affects in the children itself, and it's the language disorder. Children won't understand the words easily, so we have to tell them how to speak the language. Some people usually forget when we talk or listen, so they have 2 disorders. One is they can't understand the words, so we think listening problem, but actually they can't talk. And in this prevalences, he will be explaining the prevalences.
The prevalences rate is 6 to 10. That means 6 to 10% are causing that ADD out of 100, and more prevalent in males. They are the same like that autism, and the female ratio is 3:1. There are 2 samples, like the epidemiological samples and the clinical samples. According to these 2 samples, female ratio is 3:1. Out of 3 males, 1 female caused this ADD, and this cost is estimated between $12,000 something dollars to and $17,000 annually per individual. And what are the symptoms? It is the inability to pay attention. They did not pay the attention towards the others what they are saying. Next, hyperactivity. The hyperactivity is nothing but this is one of the symptoms, and it will be more in the boys, less than girls. And implicity. Implicity means they are doing something work. They are doing some work. They did not think about what they are doing. And these are the symptoms. And now she will explain about the causes and the treatments.
These are the causes for this. Causes are like depression, anxiety, and visual problems. So that if he or she doesn't see anything at all, so they don't know what to do. So usually they forget. They also poor at writing. They also poor at listening. So this should be done from childhood onwards. It should be treated from the childhood onwards. So in which we have two things. One is meditation, and the second one is behavior. In the meditation, we have to only people give drugs. So they sleep a lot. So it's not good for or recommended for this type of disorder. Behavioral things in which we can do by keeping an assistant for the child and tell them how to teach and how to listen, what to speak. It should be done from the childhood onwards. So in conclusion, we can say that ADD and autism both has the brain disabilities, so that they can't capture the things very easily, and it also depends upon family problems. Some people get this disease by the families, and some people won't get this. So always only both are seen mostly in children. We need to recognize which one is which. These are the differences.
Any questions?
Any questions?
Okay, next time.
Thank you.